perfect. Liz, could you go to the next slide, please? So some quick updates and announcements. July 1st, new referrals are happening at full service agencies. This is the date that we're all aware of. Referrals will be coming into the full service agencies next Friday. Also connecting families to DHH agencies. I mentioned we'll go over this a little bit later on. There will be kind of two different time points to keep in mind. Starting with that July 1st launch date, we'll keep what we're currently doing in place, which is brand new to any new DHH FRCs who haven't been referring to DHH agencies yet. So we'll go over that. And then August 1st, we'll start the welcome sessions with the 3 DHH agencies. We're giving a little bit more time to plan those sessions out with the 3 DHH agencies. I've listed where the training materials and information that we've shared lives, both in the email that I sent out and on this PowerPoint, and I'll share it out again afterward. I also wanted to share just 2 upcoming things. One is our continuing community of practice that we'll hold monthly. And an exciting thing, there will be a statewide training for FRCs supporting DHH children. The Esit team is meeting with DOH to talk a little bit more about that and hear a little bit about what that will look like in the next week. So I will keep that as kind of a recurring thing to check in on at our community of practice. So we'll go over once again the DHH point person and DHH FRC roles. At some of your agencies, this might be the same person. At some, it might be different people. So this is the same chart that we've shared before. At each agency, there will be either an Esit DHH point person, and at full service agencies, this role may be a DHH FRC as well. So the Esit DHH point person is responsible for participating in all of the DHH training requirements, participating in the ongoing community of practice monthly, supporting FRCs who are working with DHH children and their families at their agency, which may include sharing back with all DHH FRCs, ensuring DHH policies and procedures are implemented, and building collaborative relationships with DHH providers, DHH FRCs, DOH, and within reach. Our DHH FRCs are responsible for participating in all DHH training requirements, are encouraged to join and participate in the community of practice, are responsible for supporting the family through the entire process, implementing DHH policies and procedures, and building collaborative relationships with DHH providers. Both of these roles are, well, all of us are responsible for addressing and responding to concerns as they arise. I will turn this over to, or actually let me pause real quick. Any questions so far about anything that I've mentioned up to this point? All right, if there are no questions, I will pass it over to Wendy to kick it off with the assistive technology. So this may be brand new for some of you. This is our assistive technology policy.
Hi, everybody. Thanks for coming out on the second day of summer. And this is just, I want to acknowledge that presenting a policy seems super boring in a certain way. And I haven't presented this one before, so maybe you'll give me hints about what I can do better after doing this. But the idea is that children who are deaf or hard of hearing need access to some equipment. The 2 kinds of equipment that we can help them access are hearing aids and also what are called FM, or DM systems. So we'll start with the hearing aids. So we will support funding for hearing aids, and the really important, we'll do it via reimbursement for Esit enrolled children. And there are several different things that are needed. A diagnosis and need for hearing aids is documented in the IFSP. And funding support for hearing aids is needed. And in the past, we only did this when there was no other source of funding available. And now we'll do it when there's no other source of funding available, or the source of funding is less than the amount that's allowable for Medicaid. So we won't pay up to the 100% full cost, but we'll try and get, we can pay up to the Medicaid cost of hearing aids. Also, DHH FRC will partner with the audiologist to ensure that the child has access to the hearing aids, that the hearing aid has been paid for, and the hearing aid has been delivered to the child. So that it requires some communication between the DHH FRC and the audiologist. So the cool thing is, if you follow all the steps, you don't need to get pre-approval, which should simplify things. So the steps include it, so you can submit, after following all these steps, an extraordinary expense request form and attach the required documents. Copy of the child's IFSP that shows there's a diagnosis and need for hearing aids. Document of the referral or the prescription for hearing aids. A document that no other fund source is available to pay any portion of the expenses, or that the source of funding is paying less than that we could cover that gap amount. Also submitting the cost sheet from the manufacturer, which lists the single unit published price with a specific hearing aid model circled. Most of these things on like 4 is something that the audiologist would help with. And then a paid invoice that shows the child's name, the delivery date, a list of the hearing aids, ear molds, and other services, and the total amount being invoiced to King County. So again, if you can put all those things together, you can submit it to King County, and King County will reimburse your agency for whatever you've laid out. And Robin's asking about, is this only hearing aids? We are funding this with Part C of the Individuals with Disabilities Education Act, which does not allow for cochlear implants coverage. If the family can't pay upfront for hearing aids, then the agency can pay for the hearing aids and we'll reimburse the agency. The agency is paying for the hearing aids, and then the agency is reimbursed, not the family. Yep. So the agency is helping to pay for the hearing aids, and then the agency is reimbursed. Okay, more questions on this part? There's a couple more pages.
Wendy,
This part.
Wendy, I do have a question.
Sure.
About the billing of who's getting billed for what for hearing aids. If a family is purchasing hearing aids, I guess I'm still confused about how that payment is working. If a family pays for something, how are we getting all of that other information? And If their insurance is covering any of it,
Yeah,
then we would also need to know, like, have a copy of their explanation of benefits, wouldn't we?
you would work with the audiologist and the family. Most of the time in this situation, the family isn't paying. You'd mostly be working with the audiologist who would identify what the insurance level is or lack of insurance, and also the audiologist is really the one that would probably be working up the invoice, or whoever the audiologist is working with. It might be children's, it might be wherever the audiologist is. You would be working with the audiologist. And so the Esit agency would pay the portion up to the allowable amount that that the insurance isn't paying. Or the audiologist could invoice the Esit agency that amount, and then we reimburse the Esit agency the amount that is invoiced. Sounds confusing. We'll work with you on it to make sure that it makes sense. The main thing is we don't want families to have to get up with paying the cost of the hearing aids. It's really pricey. It's a lot of money, and we can do it this way and they won't have to pay.
Okay, is there going to be like a time holdup for when agencies pay? And I just want to make sure that families are getting their hearing aids in a timely manner.
Should not be a time holdup. And the county will pay up to the same amount that Medicaid would pay. So the audiologist will have to be willing to accept that amount.
Okay. Are there going to be limitations on like a cost cap? I mean, hearing aids come in all price ranges. So
yeah,
even depending on what audiologist you get them at.
Great. I'll show you. Let's move on to the next place because that explains what the caps are. And actually, I just looked up the Medicaid prices. This is just slightly higher than the Medicaid prices. The ear molds, $45 per ear, maximum 3 sets over 12 months. And the hearing aids, the single unit published price on the manufacturer's list, maximum of 2 hearing aids. The flat rate for hearing aid related services, a max of $500 that the audiologist can charge. And so again, nobody would be expected to pay the difference. They would have to be able to accept these amounts. Not paying for batteries. And let's see, Mary Beth and Candace, we can pull up the IDEA legislation, but so I don't know the answer about bone anchored sound processor on a soft band. Does anybody else know the answer to that? We'll look up what the IDEA allows for and see if that's one of the things that's allowed for. So one other thing I will say back on this one, we've understood that recently Children's Hospital has been finding a mechanism to pay for hearing aids. So this would be if that mechanism is not in place for whatever reason, you could use this approach. I'm not sure that's true 100%. We've had this policy in place. It hasn't been used, or it's been updated, but it hasn't been used in a while because kids have been getting their hearing aids paid for using other mechanisms. But The idea is there is a backup mechanism. If nobody else is paying, if these costs aren't covered, we can contribute to this amount of the costs. So I'm just going to pause. That's all on the hearing aids. Any other question on that? Okay. Really, they're called DMs, but when you look up the definition of DM, it says digital and it doesn't make reference to the M, which, so I just left that, and some people call them FM or DM, but I think they're all DM systems right now. We've been calling it a FM loaner bank for many years. So King County also has an obligation to ensure that children have access to FM or DM systems if they're identified as necessary on the IFSP. We fund this FM DM loaner bank at Seattle Children's Audiology, and we won't purchase individual systems for individual children. So they can use the FM loaner bank. The FRC will make a request to the, FMDM loaner bank and work with the loaner bank to acquire the system. And kids can access it even if their regular audiology is somewhere else. They can still access that FMDM loaner bank. Let me ask you a question. Would it be clearer to just change it to DM loaner bank? Would that help with clarity from folks in the know?
This is Mary Beth from Listen Talk, and I recently attended an best practice evidence-based pediatric audiology session by Beth Walker, and she recommended that we all go towards DM only. Although in her next statement, she herself said FMDM because we are so accustomed to it, but that yes, the technology currently is DM. So that is the best practice to work towards.
Mary Beth, did you say best practice would be to call it FMDM right now, or to call it DM? Just DM.
The technology has morphed into that. It is DM.
This is Norma. I don't know if Wendy froze or if it is my internet because I have been having internet issues today. But we will update that on the policy that goes out to everybody. We'll have some of the documents that we've mentioned before that we've been compiling updated and put on the website tomorrow. One of them being the frequently asked questions that we've gathered at all of these sessions. Another document being all of the policies in one place, and the contact list for the Esit DHH point people, the DHH FRCs at each agency, and contact info for our DHH providers.
Norma, this is Kayla. Just Robin put in the chat that like FMDM is like what people know. FM stands for frequency modulation, DM stands for digital modulation. Like it is correct that we are using DM technology, but I don't know if we'll lose people if we drop the FM. And I don't know if spelling out digital modulation helps anyone know what we're talking about. Those are just my thoughts, because yeah, I completely agree that digital modulation is the correct description of what it is, but do people know what we're talking about if we use that?
Thanks, Kayla. I appreciate that. I was wondering too if that might opt people out or if maybe just keeping the FM/DM in the policy opens it up for folks. So we are flexible in keeping that verbiage in the way that it's currently stated, or taking it out if that's the correct route to go.
Norma, this is Mara. Maybe there's a way to support the transition and build the understanding, you know, it's sort of like you spell something out the first time and then use the acronym that follows. So maybe it's described as FMDM with some standard language in our reports, in the request, and then we just start moving toward updating everybody. You know, to build that recognition. So I absolutely think that we want to support people in understanding the terminology, but you know, it's been a little while since we've been working with DM, and I think we can figure out a way to make that switch.
I love that, Mara. Thank you. Maybe in the policy we can just list it as context setting, but then start moving toward DM, like you said. And I mean in the verbiage of the documents. Are there any other questions around the loaner bank or the assistive technology policy before we move on to how to connect families to DHH agencies in July?
This is Kayla again. I'm just wondering, you're sending out the policy. I don't know, is it going to be posted somewhere? Is there? It is. Okay, sorry, I missed that.
Yeah, so we'll post all of the documents that I had mentioned before that we were working on, like the FAQs and the contact lists, to the website. But since we had not shared the assistive technology policy with everybody prior to today, we'll send that via email separately as well, so that you can take a look at that. Robin is asking, will you send the fax request sheet to each agency? There's a form I submit to make a request. And yes, I think that we can do that. All right. So if there are no more questions about the assistive technology or the loaner bank, we're going to move into how the DHH FRCs are going to support connecting families to the DHH agencies in July, in the interim before we launch the welcome session with the 3 DHH agencies. So we're in the planning stages with the DHH agencies to get the welcome sessions fleshed out properly so that everyone feels comfortable and confident before we roll those out to families. So we're pushing that to August 1st, and we'll update folks along the way. My goal or hope for having those ready to go is for them to be on everybody's calendars, so that you know when they are for the entirety of the year. So from August to June of 2023. So we have a little bit more time and wiggle room to talk more about the welcome sessions later on. So in the interim, in July, the DHH FRCs are still going to need to connect families to DHH agencies, and we've been talking about the welcome session. So we wanted to make sure that our DHH FRCs at full service agencies know what to do. So our pilot DHH FRCs have been, once a family is referred into Esit and connected with a DHH FRC, DHH FRCs would share the video and the flyer and give families the information that they have a choice between 3 agencies. And then after that, the DHH FRC sends a referral email to the DHH agencies, and I'll let our pilot FRCs interject if I'm butchering this or saying it incorrectly. But a referral email goes out to the DHH agency, and then the DHH agency reaches out to the family within 2 business days to connect. So families, the hope is that they would connect with all 3 agencies, and the DHH agencies encourage families to connect with the other 2 agencies when a family self-refers or connects with them individually. And then once a family connects with the DHH agency, they can get more information from that agency directly. Essentially, the welcome session plan is to cut down on those 3 meetings. And so a family would be able to meet with all 3 DHH agencies in one spot. In this way, families are meeting individually with each of the agencies. And I'll open that up to Elizabeth and Robin. Is there more to add to that maybe I'm missing?
No. They the only thing that I would notice from the referral process of sending information to the DHH agencies, I would just include like maybe information on what to include, and if you could have that written down, that would be helpful. Like the DHH agencies want contact information, and you know, we get a release of information signed, and we if there's an IFSP in place for some reason, like we send that over. So just making sure that they have like a good picture of the family before they reach out to them is helpful. But also the only other note that I would make is a lot of the times families pick like 2 agencies to chat with, and not usually all 3, but yes, the other agencies do encourage you to talk to everybody. Thank you, Robin. And yes, you need to send their audiogram or their report.
I lost my mute button for a second. And one thing just to reiterate that we've mentioned before, when the DHH FRC is sharing this information with families, we want to make sure to share the flyer and the video and the information that there are 3 agencies to choose from and the family has a choice. And then if you remember the what to share versus what not to share table that we had at one of our previous sessions, we would not want to share program-specific information, personal opinions that may influence a family's choice or personal experience with programs or approaches. You really want the families to connect with the DHH agencies with as unbiased as possible information upfront so that they can speak directly to the DHH agency and get their questions answered from them directly. There's a question in the chat from Betsy. Are flyers, videos translated? And Elizabeth answered it. Flyers come in 6 languages. The video is in English and has Spanish captions. And the hope with the welcome session into the future is that families would be able to access the 3 DHH agencies all at once, and knowing ahead of time what the family's accessibility needs are, we could provide interpretation in that space directly for them. Any other questions about the July way of referring families to DHH agencies? Robin says, my video has a different language for captions, so I'm guessing there is a way to get other languages. I can look into that. I had done a little bit of a deep dive into what materials are out there, and I think I saw some other things that might not be on the site. So I'll look into that. Any other questions, comments, hopes? Excellent. So we're going to move into learning from our current DHH FRCs. Our pilot DHH FRCs who have been doing this for a few months now were graciously accepted answering some questions from us. So we have some questions that we pre-made for them, and we'll open up the space for any questions that the group has for both our current DHH FRCs and for us at King County as well. And I won't put you on the spot and spotlight you, Elizabeth and Robin. We can do this pretty casually. We can either keep the slide up or can remove it, and I can ask the questions as we go along, whichever feels more comfortable to either of you.
I am open to either.
I'm just catching that Robin said, knowing who to send the referrals to at each agency would be helpful for new FRCs. Absolutely, that is part of what I'm including in a spreadsheet that I'll have posted to the website, hopefully by tomorrow, definitely before July 1st, of who the referral folks are at each of the DHH agencies. I think for ease, we'll just keep the slide up like this, and we'll go one by one. So to both Elizabeth and Robin, what do you enjoy about working with DHH agencies?
Okay, Robin, I guess I'm first. Saw you in the chat. So the biggest thing that I enjoy about working with the DHH agencies is the collaboration. I think it's really important that we put collaboration first, and it's something that is required of us as DHH FRCs. One thing that came to mind, particularly in the role of an FRC with the DHH agencies, that I really enjoy is the transition process. When you think of a family who has come to us with a baby who is very young and has been in Esit for 3 years, and then we're transitioning them out. That is a big change for a family. And the DHH agency not only starts talking about that transition very early, like at 24, 25, 26 months of age, getting them really prepared, but they're also there the whole time. So they come to the transition meeting, they come to IEPs if family requests them to be present. So I think just having them kind of hold the family with us and be an advocate with us, which is our role as FRCs, is really awesome. So I think that's probably my favorite part of working with them.
Should I just go ahead and add? Okay. Ditto. I love the collaboration and the support, and I just love the passion. Everyone clearly cares about the work they do and the children and the families. And a lot of times these families are working with these providers for close to 3 years. So they, really have this close kind of relationship often, which is really cool. But also I've loved that when I was learning and still have some questions, they're very willing to work with me and explain things. And, I think we've both done that for each other, but I don't know, they're just all great people to work with, I think.
In what ways is your DHH FRC work similar or the same to your other FRC responsibilities? And in what ways is it different? And if we want to go in the same order, Elizabeth, then Robin.
Sure. So I think this will vary by agency. I think that's something that is really important to note. Some roles and expectations that each agency has is different for the FRC. So the expectations that King County has on the DHH FRC may be exactly what you already do at your agency, or it might be completely different and there's added roles. So I don't know if speaking specifically to what is the same and what is different is helpful. But I do think that speaking kind of generally as my role as a DHH FRC, I feel like it requires more collaboration, more communication, and a lot of organization. Because I'm working with 3 outside agencies, those providers are not tied to kindering standards. Oh, I'm at kindering, by the way. And they're not tied to kindering practices. Like, they don't have access to our databases. I have to be communicative, and I need to look ahead at timelines and connect with therapists and just stay really organized with my outreach to all of them. And so I think that because I don't have my databases and my information that kindering has, with my normal kindering therapy teams readily accessible with the DHH agencies, it does ask of me more to be more collaborative and more communicative with the DHH agencies. So I think that's where it varies the most. When it comes down to similarities, I would say we're all here for the same reason, is to support children, whether that children has hearing loss or not. So there's no varying difference in that. My hearing kids on my caseload are still getting the same love and support that my deaf and hard of hearing kids on my caseload are getting. So we're still advocating for their success and wanting to support them. But I think the biggest, a lot of what we do is very similar. There's just a little bit more organization that comes and collaboration that comes with this role.
And I have only been a DHH FRC, so I haven't had the other role, but I had 3 things I just wanted to point out that may or may not be something people might want to know. And I thought I'd throw it to this question. It didn't really fit anywhere. One thing that you'll notice that might be different from your own agency, the reports all look a little bit different from each of the DHH programs and between providers, as well as some of the assessments they're using. And so just reaching out to them if you have questions about their reports and what information to use. Like HSDC has a visual VCSL or something assessment they use, and that includes the receptive and expressive language. It's not broken out. So for your plods, so it just looks a little bit different, and just don't be afraid to ask them would be something I encourage you to do. Likewise, they work with 3 different counties, all of whom asked them slightly different things to be done. Some want them to do the vision. King County has providers do the vision. Other counties don't, that kind of thing. So again, that's where I think that open collaboration with them is so wonderful, just to kind of follow through. And the only other thing that might be different, though a lot of you have deaf and hard of hearing kiddos already on your caseloads, knowing where to look on the audiology report for the diagnosis, you'll figure that out, but just might take some getting used to. And I'm sorry about my voice. Anyway, thanks.
I think that ties in perfectly to the next question. How do you stay organized?
I make a ridiculous amount of to-do lists, and spreadsheets, I would say, are my best friend, as well as my Outlook calendar. There's a lot of steps in our process of sending in a referral, of contacting the agencies, of prepping, making sure that we're offering times and dates for an annual prior to when Esit requires us to offer those times and dates. And so I think it's really important to have kind of a checklist of all of the steps that we need to meet, make sure that we're taking note of the contact that we've made to all of the agencies, making sure that we're documenting, that the referral was sent on this day and that we received the audiogram on this day, and here are when the reports are due. And I do that all in spreadsheets. It took a little bit to get used to of like what I would need, and I still edit and change it, but I really just want that like checklist of these are all the steps I need to hit, and make sure that everybody gets the information that they need. Again, especially because our only point of sharing items is Esit itself. So making sure that we have uploaded the documents that the agencies need, and making sure that if a provider doesn't have access to Esit, like that they know timelines are coming up. So really keeping dates and things organized in a spreadsheet has been my biggest help, and making sure that I write my to-do list into my calendar so that I make time for that has been the best way for me to stay organized. And Robin says same, except her to-do lists are on paper.
Robin, did you want to add more, or do we want to move to the next question? Next question. Can you share how you handle difficult questions?
Yeah, I think it's really important to listen to parents, validate their concerns, and offer guidance as best I can. There's a lot that I can answer when it comes to being an FRC, right? What's it going to look like at the transition process? How much is this going to cost me? What am I going to need when my child turns 3? How are you going to support me in that process? Those are all FRC questions that we're all very confident in answering. The most important thing that I can tell you is if it is DHH related, that question needs to go to the agency. And that can be really hard to redirect a parent when they really want answers. And so that really stands out to me in being a best practice of, it is not my role to educate families on the DHH agencies. I have a very rich and vast DHH background, and my families don't know that because I'm coming to this place with a non-bias and making sure that I'm not swaying their decision in any way. And so being able to redirect their concerns, if it is something that I cannot answer, or if it is something that is DHH related, is really important. And so I really just hold them and say, I hear you, this is absolutely a valid concern or a really great question, or whatever the difficult question may be, but I want to encourage them to bring those questions or write those questions down if they are DHH specific, so that they can go to the right person to get the answer or the support that they need. And the DHH agency isn't going to be able to tell them that their 8-week-old is going to be speaking fluently at 3 years of age, but it's really important that they are giving them they are directing the questions to the right person. And so if it's FRC related, I'm happy to help. But if it's DHH related, I want the agencies to really hold the families. But I want to make sure that they're heard and that they're validated, and then I can, connect them with who they need to talk to in order to get their question answered.
Yeah, I always like to just throw it out there to the families that I'm not the expert. I don't have the background to answer some of those questions, because sometimes they really do get really deep about the child's specific hearing levels, or how a program would work with that. And even if I know the answer, I usually try not to answer, because then it just takes you down a rabbit hole sometimes of a million other questions. So they've all been really receptive when I've said that, and I've never had any pushback against that.
What do you do if a family asks your opinion about choosing a DHH agency?
I've had this happen a couple of times. And I kind of have a little spiel, so forgive me if I give you the spiel. But I usually say this is a really great question, but nobody knows your family best or your child better than you. It's really important that you consider your family culture and routines and conversation and how an outside agency could support you with that through your child's communication. And I encourage you to meet with all three programs if you're struggling to decide. Bring a set of goals or questions that you have, and interview the programs, really see which one best fits you and your child and your family dynamic. And to always remember that you can change programming in the future. So if you make a choice right now, it's not forever. And if a different program is a better fit as your child gets older, be happy to help you transition to that. But when you really don't have an idea of which agency is best, it comes down to what is best for your family and really taking the time to meet with each agency so you can learn more.
Yeah, we only needed Elizabeth on this panel. She's got it all down so perfectly. Thank you, Elizabeth. That's, yeah, absolutely. Just reminding them it's about their family values, what they want for their child. Just like Elizabeth already said. I have worked with families with all different hearing levels, choosing any one of the three programs. And so it really just comes down to what they want. Some want to be connected to the deaf culture, but their child has a mild hearing loss, and that's fine, So yeah, thanks, Elizabeth. That was well said.
Robin, I just want to second that because I think that's so important. I think a lot of assumptions come with hearing loss. I was raised in the deaf community to say that, to have a assumption that a child with a mild hearing loss is automatically going to want spoken language, like that's so not the case. Parents are really choosing and thinking about what they want for their family, the language that they want, and the support that they want from their family. And so making, by us assuming that we know, oh, they have mild unilateral hearing loss, well, they're going to want, a spoken language program, or they're going to want speech and spoken language. You can't make that assumption. And so that's why we have to come so non-biased to the conversation and be able to really have the families think about their dynamic and their routines and how they want to support their child, because it's not about those assumptions. It's about what they want and what they want for their family and how they want to connect to the communities that are out there.
Thank you. So how important is clear communication and why? You alluded to it before.
I can't do my job without clear communication. I feel like it's so important for everybody to be on the same page, to collaborate, to be able to come to one another when we have questions, to be able to support an FRC when they're struggling. Like I feel like there's so many pieces that require communication and honesty and respect for one another, and just making sure that you are clear in what you need, and that you are leaving the door open for feedback and willing to collaborate if there are miscommunications or ways that communication could be better. I just think it's so important. I send a gajillion emails because I've got to juggle a bunch of different therapists and, people who I send referrals to, and there's different people from the agencies that I work with, and just making sure that everybody is on the same page and everybody really knows what's happening with this family. Again, because like I said, at Kindring, we have a database that we use that a therapist could very easily look in and see that this family is having a hard time. But an outside agency doesn't have access to that. So I really need to make sure that I am communicating the needs of the family to the provider, and I'm also supporting the provider in any needs that they have. And that just comes down to clear communication and being willing to communicate a lot and email a lot.
Yeah, and that communication can include, giving dates you need things, being specific, or a phone call, because sometimes you think your email is very clear and it's clear that it's not. And sometimes a phone call and a chat helps me actually clarify that what I'm trying to communicate with them. Yeah, sorry, you guys, I'm having a hard time talking today.
I really appreciate that from both of you. As a person who communicates better in writing, sometimes I'm wordy, and I appreciate it when people point out, is this what you meant? I think just encouraging that culture in this community in general, like always feel free, absolutely with me, always feel free to do that, and with each other. Clarify communication. I often think that the words that I put out, people are going to understand them the way that I mean them to, but everyone processes differently. So I really appreciate both of your answers. So our last formal question, where do you go for support or answers to questions?
I usually go to Robin. Robin and I have been doing this and piloting this since, well, Robin's been a DHH FRC the whole time, but I started taking kids from her in September. So we've been doing this a while and we collaborate a lot, but there are a lot of things that I go to Robin for. And I do want to open it up to anybody here that's a new DHH FRC. Please don't hesitate to reach out to me. Happy to answer any questions. But when I don't have answers, or when someone doesn't have or Robin doesn't have answers, or we need help, I mean, we often go to Norma and Wendy. They have both been very supportive in responding to us and answering questions. I'm also very grateful for my managers at Kindring. And the biggest support are the DHH agencies. They're going to be the one that know, a lot of the questions that we need answers in terms of what their agency can provide and what they can do for a family, or what lines of support or areas of support that they can help in. Maybe the FRC related things like paperwork or questions around evaluations and stuff that needs to be done internally or with Wendy and Norma, but really just figuring out who can help you with what. But there is not a single agency that would not answer your question if you had a question. So whether that be reaching out to me at Kindring and asking, I forgot how to do this, can you explain it? Or that means, reaching out to the DHH agencies to learn a little bit more about their process. I think everybody, what I love about this community is that everybody is willing to help one another. So you're not alone.
And Robin wrote in the chat, nothing to add to what Elizabeth said. I think that's a really brilliant way to end our formal questions. You're not alone. Feel free to reach out and ask questions. I'm also still learning, so might not have all the answers, but I will try to track things down. There's a question in the chat. Can new DHH FRCs join in one of the welcome sessions to just listen and learn more? Yes. DHH FRCs are welcome to join any and all of the welcome sessions as they would like. They're not required to attend all of them, but if they'd like to join with a family, more than welcome to. We're also hoping to possibly at either our July community of practice or August have sort of a dress rehearsal type presentation for the DHH FRCs. I'm going to turn our recording off and open it to questions for the remainder of the time that we have together.